Welcome back to Wally's nursing videos. In today's lesson, we'll break down inflammatory bowel diseases, IBD, specifically Crohn's disease and ulcerative colitis, and look at how they lead to malnutrition and complications like bowel obstructions. We'll also discuss important lab tests and diagnostics that can help nurses differentiate between the two diseases. And of course, we'll cover essential nursing assessments and interventions. By the end of this video, you'll be able to understand how IBD leads to malnutrition, differentiate between Crohn's disease and ulcerative colitis using lab tests and diagnostics, recognize the signs of bowel obstruction in Crohn's disease, learn the critical nursing assessments and interventions for IBD patients. Let's get started. What are inflammatory bowel diseases? First, let's talk about the two major forms of IBD, Crohn's disease and ulcerative colitis. While both cause chronic inflammation of the gastrointestinal, GI, tract, there are key differences. Crohn's disease. This disease can affect any part of the GI tract, from the mouth to the anus, but it most commonly targets the ileum and colon. In Crohn's, the inflammation is patchy, known as skip lesions, and affects the entire thickness of the bowel wall, often leading to complications like strictures and fistulas. Ulcerative colitis. This condition is limited to the colon and rectum and involves continuous inflammation, starting at the rectum and moving proximally. The inflammation in ulcerative colitis is superficial, affecting only the mucosa and submucosa layers of the intestinal wall. Key learning point 1. Crohn's disease involves the entire thickness of the bowel wall and can affect any part of the GI tract, while ulcerative colitis is confined to the colon and affects only the mucosa. How IBD leads to malnutrition now. Let's focus on how IBD leads to malnutrition. Chronic inflammation in the intestines can interfere with nutrient absorption, leading to nutritional deficiencies. Here's how it happens. Inflammation. In both Crohn's and ulcerative colitis, inflammation damages the intestinal lining, decreasing the absorption of nutrients like proteins, fats, and essential vitamins and minerals. Malabsorption. Crohn's disease frequently affects the small intestine, leading to poor absorption of fats and fat-soluble vitamins, A, D, E, and K. Ulcerative colitis can cause malnutrition through chronic diarrhea, which decreases the time available for nutrient absorption. Diarrhea and electrolyte imbalances. In ulcerative colitis, frequent diarrhea contributes to dehydration and the loss of electrolytes like potassium and sodium, compounding malnutrition. Key learning point 2. Chronic inflammation in IBD damages the intestinal lining, leading to nutrient malabsorption. Crohn's disease commonly affects fat and vitamin absorption, while ulcerative colitis often causes diarrhea and electrolyte imbalances. Nursing assessments and lab tests for malnutrition in IBD patients. As nurses, we need to assess patients with IBD for malnutrition by evaluating physical symptoms and reviewing lab results. Here's what you should include in your assessments. Nutritional assessment. Ask about recent weight loss, food intolerances, and changes in appetite. Many patients with IBD avoid certain foods that trigger symptoms, which can exacerbate malnutrition. Physical exam. Look for signs of malnutrition such as dry skin, muscle wasting, and poor wound healing. Dehydration signs include dry mucous membranes and poor skin turgor. Labs for malnutrition. Serum albumin, 3.5 to 5.0 g/dl. A low albumin level indicates poor nutritional status, often due to malabsorption. Total protein, 6.0 to 8.3 g/dl. Decreased protein levels can indicate protein malnutrition. Vitamin B12 and folate. These levels are often low in Crohn's disease due to impaired absorption in the ileum. Electrolytes. Monitor electrolytes like sodium, 135-145 MEqL, potassium, 3.5 to 5.0 MEqL, and magnesium, 1.5-2.5 MEqL, especially in patients with diarrhea or dehydration. Key learning point 3. Assess IBD patients for malnutrition through physical exams and lab values like serum albumin, total protein, vitamin B12, and electrolyte levels. These values help identify malnutrition and dehydration early. Diagnostic tests to differentiate Crohn's disease and ulcerative colitis. Nurses should also be familiar with the lab tests and diagnostic procedures that help differentiate Crohn's disease from ulcerative colitis. Let's go over the key tests. C-reactive protein, CRP. Normal range, 0 to 1.0 mg. Elevated CRP indicates inflammation in the body. While this test doesn't specifically differentiate Crohn's from ulcerative colitis, CRP tends to be more elevated in Crohn's disease during flare-ups. Erythrocyte sedimentation rate, ESR. Normal range, 0 to 20 mg. Like CRP, ESR measures inflammation. It is often elevated in both Crohn's and ulcerative colitis, but higher levels are common in Crohn's due to deeper, more extensive inflammation. Stool studies, fecal calprotectin. This test detects inflammation in the intestines. Elevated fecal calprotectin levels, 50 mcg, indicate active inflammation and can help distinguish IBD from irritable bowel syndrome, IBS, which does not show raised levels. Colonoscopy with biopsy. This is the gold standard for differentiating between Crohn's and ulcerative colitis. In Crohn's, biopsies may show patchy transmural inflammation with granulomas, while in ulcerative colitis, the inflammation is continuous and limited to the mucosa. Small bowel imaging, CT or MRI enterography. This imaging test is used primarily in Crohn's disease to visualize inflammation, strictures, or fistulas in the small intestine, which is often unaffected by ulcerative colitis. Key learning point. 4. Lab tests like CRP, ESR, and fecal calprotectin help identify inflammation in IBD, while colonoscopy with biopsy is the most definitive test to differentiate Crohn's disease from ulcerative colitis. Nursing interventions for malnutrition and IBD. Now, let's talk about nursing interventions to manage malnutrition and support patients with IBD. Dietary support. Advise patients to follow a high-calorie, high-protein diet to prevent further weight loss. During flare-ups, suggest a low-residue diet to reduce bowel irritation. Vitamin and mineral supplements. Administer iron, calcium, vitamin D, and vitamin B12 as needed. Crohn's patients, in particular, often require supplements for fat-soluble vitamins due to malabsorption. Hydration and electrolyte replacement. Ensure patients stay hydrated, especially those with frequent diarrhea. Administer oral rehydration solutions or IV fluids as needed to correct electrolyte imbalances. Parenteral nutrition, TPN. In severe cases of malnutrition where oral intake is insufficient, total parenteral nutrition, TPN, might be required to provide essential nutrients directly into the bloodstream. Key learning point 5. Nursing interventions should focus on ensuring adequate nutrition, correcting deficiencies, maintaining hydration, and considering parenteral nutrition in severe cases. Bowel obstruction in Crohn's disease. One of the serious complications in Crohn's disease is bowel obstruction. Here's what happens. Strictures and obstruction. Chronic inflammation in Crohn's can lead to scar tissue formation, resulting in strictures, which can block the intestines. This causes severe abdominal pain, vomiting, and an inability to pass stool or gas. Nursing interventions. If bowel obstruction is suspected, monitor the patient closely for worsening abdominal pain, distension, and absent bowel sounds. Insert a nasogastric NG tube to decompress the stomach and prepare for potential surgical intervention if the obstruction doesn't resolve. Key learning point 6. Be alert for signs of bowel obstruction in Crohn's disease, particularly in patients with known strictures. Early recognition and intervention, including NG tube insertion and surgical referral, are essential. To wrap up, Crohn's disease and ulcerative colitis are two distinct types of IBD that can lead to significant malnutrition and complications like bowel obstructions. Understanding the key labs, diagnostics, and nursing interventions will help you provide the best care for these patients. Thank you for tuning in to Wally's nursing videos. If you found this video helpful, don't forget to like, comment, and subscribe. See you in the next episode.